Okay, we're right here at the top of the hour. So I'd like to welcome everyone in. We're going to go ahead and get started. My name's Matt Harrell. I'm in the marketing team here at Clearwave, and uh, I'll be your moderator today. I should mention that. But today's session is all about patient acquisition, and it kicks off our three-part LinkedIn Live series. What we're really hoping to do with this LinkedIn Live series is give you some tactical insights in a quick 15-minute session format. Ultimately, give you a couple bits of food for thought and allow you to get back to your team. So we'd love your feedback. We'd love to hear if this is a format that you like, something new that we're trying, and ultimately want to see if you all like it. So feel free to drop us a comment after we wrap up today and tell us what you think, if you'd like to see more of this or not. Speaking of comments, as we go through the session today, if you have any questions, feel free to drop them in the chat. We're going to do our best to honor that 15-minute time frame, but we might have time for a couple of questions at the end. If not, we'll make sure we get back with you after our session concludes. And then last but not least, last point of housekeeping here, we're actually going to give away lunch to someone who joins us live here today. So the only caveat is you've got to stick around to the end. So be sure to do that. Stay with us. We'll keep to that 15-minute time mark, and we'll pick somebody and send them a food delivery gift card on us. Easy as that. So let's get to today's topic, shall we? I've got two incredible healthcare marketing executives joining me today. Uh, First is Jonathan Reese, VP of Marketing at SocialClimb, and Kristen Bryant, VP of Marketing at Clearwave. And then going to the next slide, they're going to cover how we calculate patient acquisition costs, what that mix looks like, and then round out our discussion on how to optimize for conversion along the way. So, Jonathan, Kristen, welcome to our LinkedIn Live session. Jonathan, you're sort of up first here, but before I do that, I would be remiss if I didn't wish you a happy birthday. I just got an alert right before the session that today is your birthday. Thanks for spending your special day with us.
Matt, you weren't supposed to know that, but thank you. So
I have sources. I have sources.
yeah, I got to find that source. Well, thanks. I'm excited to kick this off as well. Any more business? Or should we jump right into it?
Yeah, let's jump right in.
So I want to talk about the constructs of the patient acquisition cost a little bit here. You're welcome to click the next thing. I guess there's a build on this slide that I wasn't aware of. But if you look on the left-hand side of the screen here, you can see all these different marketing components. These are a bunch of different channels that we as marketers often use to attract new customers, attract new patients in this case. And obviously this isn't a conclusive list, but there's quite a few things that go into a marketing mix. As you can see here, we've got them separated into paid ad or paid and earned media. Paid obviously costs money to do, and earned is organic social media and things like that. So they all funnel over into these two things in the center of the screen where it says book now or phone call. So what we're looking at here is all the different components of marketing and how we get them and convert them into actual people into your practice or patients into your practice. If you'll click again there, I'll show another part of the illustration. If you can see the book now and the call, there's a little $ under each one of those. As you do your marketing efforts and drive people into your practice, whether that be your website, whether that be social media or your reputation, any of these different components actually have an element on there to convert those prospects into patients, whether that is in online scheduling, and we'll go into that a little bit later, or they pick up the phone to call your practice. That costs money as part of the patient acquisition costs. And so onto the next slide, we'll look at, if you flip that and turn that vertically, it's kind of the stereotypical marketing funnel that we've all seen in lots of different industries. And it's not It's not unique to other industries. Healthcare uses it as well. And for the sake of simplicity and the 15 minutes we have here today, I'm going to focus on the demand capture and the conversion to patient. Demand capture is basically capturing the demand out there in the audience, in the market, that is actually looking for you. Those are the keywords and search ads that are doctor near me, or knee surgery near me, flu shot near me. Those are the kind of things that people are looking to find a doctor in their local market to fulfill their healthcare needs. Obviously, there's reputation, the website's component of that, but that's the demand capture. People are actually looking for that type of service. You want to be in front of them. You want to make sure that you're staying in front of that pent-up demand almost in the audience. Then if you're going to go to the next slide, this is the bottom part of that funnel where you need to convert them. So they're looking for the service, they're looking for a flu shot, they're looking for a knee surgery, whatever it may be. They find it, they find your website, excuse me, and you want them to schedule. You want them to schedule a visit with the physician. So they can either pick up the phone to do that, or they can self-schedule online. Now, as we saw in the previous slide, that self-scheduling is considerably cheaper than a call center. Maybe you don't have a call center, but there is someone that physically has to pick up the phone and answer that call, which is an incurred cost in getting someone to schedule time within the practice. So obviously the patient acquisition cost is a component of all, marketing mix, what you're doing from a marketing channel, getting them into the self-scheduling call center, and you want to minimize those costs. So if you go to the next slide, we'll take a look at the actual equation for patient acquisition costs. So within marketing, you have to know, you have to do reporting, or you're kind of wasting money, or at least you could potentially be wasting money. So understanding, where they came from, how much you paid to get them to the website, or the ad or reputation, and the number of patients you acquired from that campaign. Not to miss the acquisition cost or the conversion cost as well. Did they call? Did they click online to schedule that? So both of those are components of patient acquisition cost. Well, excuse me. At the bottom here, you can actually go out and figure the URL at the bottom of the page here. You can actually go out and figure your patient acquisition cost. We have a cool little calculator online, just to go out and test your own patient acquisition costs. But just to recap, and we'll be quick here. On the next page, you can take a look at. You pick one of your campaigns. Would you mind going to the next page? There you go. As you see here on the left, this is the marketing mix, or the bunch of different marketing channels. Pick one of them. Obviously, the patient acquisition cost, you can average it over all of them, but for granularity's sake, you want to make sure that you go, okay, well, we sent a postcard. We sent a postcard for the seasonal flu shot. We want to make sure that we get them in and convert them. So you, let's say you sent $5,000 on postcards. You specifically, you have them online scheduled. They come to the website, they scheduled, and you filled up your physician's schedule online. Well, let's say you spent $5,000 on that postcard. You got 20 new patients. Your patient acquisition cost is $25. You got $25 per every patient coming in. Now, is that a good or a bad thing? Well, that really, you'll have to tune into our next week's episode on lifetime patient value to determine, is my patient acquisition cost good or bad? Because $25 to acquire one patient could be phenomenal if you're doing, if they're looking for one type of healthcare. Maybe a flu shot, that's not great, but knee surgery or cardiovascular or something, or a cardiologist or something may be very, very worthwhile. I've seen, patient acquisition costs be astronomically high, but for a back surgery, that costs, $20,000 or $30,000. So they all varies. The patient acquisition cost is very contingent on, or the value of that patient acquisition is very contingent on what you're attracting the patients for. Now, you can adjust your marketing mix on the left-hand side of the screen to be very focused and very targeted on a particular type of patient. Say you were sending postcards only to cardiology. Well, cardiology tends to be a little higher patient acquisition or lifetime patient value. So you can spend a little bit more on those. So you want to actually know this patient acquisition cost, minimize the conversion dollars by booking online, or minimizing your calls in to fill out that patient schedule. Now with that, we'll be talking next week on the lifetime patient value to determine, if this patient acquisition cost. Great. With that, I'll turn it over to Kristen and we can talk about the conversion.
Thanks, Jonathan. Marketing is super important. As two marketers will tell you, maybe the most important, right? To getting those patients through the door and converted into lifelong partners of your practice, right? Consumers have been going online for years to become more educated about healthcare and healthcare decisions. And now we're seeing that more consistently, and that consumers are demanding the same access that they've had in other areas of their life with their healthcare practices, right? They may even abandon a practice that doesn't offer digital access. The demand for ease and choice in online scheduling has really picked up over the last few years, and that's across the age spectrum. It's no longer just those younger patients, it's patients of all different ages, right? Consumers are used to instant access. They can book a flight on the go, order dinner to their door from their phone. It's time healthcare provide the same on-demand access, right? Patients who are using a request an appointment are missing out on consumers who are willing to book an appointment directly at your website. So as a practice, really think about what's that call to action on your website. And my advice would be don't make it a dead end request an appointment. So let's look at three options on our next slide of different kinds of patients who interact with practices, right? So patient A finds a phone number on your website, they call in to schedule the appointment. On average, it takes a patient 8 minutes to schedule an appointment over the phone, and in many cases longer depending on what time of day they call, right? That lunch hour tends to be high volume and less staff. And of course, you probably already know this, right? But this is inefficient for patients and staff alike. Requires staff to scale as your practice grows to add more staff members. And back to the patient acquisition cost calculation, increases the cost of your PAC by adding in additional staff resources to the equation. Now let's look at patient B. They complete a request an appointment form on your website, but they have to wait to be called back. Practice call volumes are 24% higher when direct online patient self-scheduling is not available, and still requires staff resources to review these forms, make the return calls to those patients. This is what I call that dead end call to action. You have a captive patient eager to schedule an appointment, and although better than no form on your website, you're still missing out on a full conversion potential here and increasing your patient acquisition cost. And then finally, patient C comes to your website and can schedule an appointment directly from your website. They can upload their insurance card, upload their driver's license. That information is sent directly to your patient management system or EMR, and your practice can see whether the patient has verified insurance and what their copay will be. This requires no staff to intervene to schedule. It enables patients to find an appointment at a time convenient for them, 24 hours a day, 7 days a week. You have a full conversion right to your provider schedule with no staff required to intervene. In a recent patient survey, 77% of patients said that they wanted to schedule online, and that was a key important factor in selecting practices for them. So think about your own workflow. If you're practice A or practice B, how many patients request an appointment but never get scheduled for one? And on our next slide, we'll talk about really ultimately online patient scheduling is about creating a better patient experience, expanding your reach and allowing your practice to be more accessible to the consumers you want to serve. As you look to market to different patient populations to increase the scope of your reach, online scheduling is a key strategy. Online patients have higher capture rates and online scheduling rates than other patients, enabling you to grow your practice and increase revenue at a higher rate than you have to grow staff to support that growth. By integrating self-service scheduling into all of your online and offline marketing channels, you can really optimize conversions. So I'll show a couple examples of the next slide of clients that did this with online scheduling and a healthy marketing strategy. So one client in the upper left-hand corner saw a 6-fold increase in new patient acquisition after implementing the online scheduling tool. Other clients have seen an increase in advanced appointments and last-minute appointments being accommodated. Many of these practices move to online scheduling in the hopes to attract new patients, which it definitely does. But what's also interesting is that the adoption rate by established patients can be quite high as well. This is a patient experience lift for both new patients and existing patients alike. Not only does this help improve conversions, but has additional benefits like an increase in practice reputation and reviews to help attract even more clientele. And finally, we understand that digital adoption can be daunting for many practices. Implementing new technology and training staff, if we'll go to the next slide, can seem out of reach for organizations, but it's really about prioritizing what you need for your organization and keeping things simple with a partner that can help you through that transformation. What is your goal? And then focus on how to deliver that to your patient in the simplest ways. Keep the patient experience at the forefront of what you're building, what's meaningful and what's relevant to them, and keep it streamlined as possible. Think of it like an open table reservation. You can do it in 45 to 60 seconds. Of course, the care you deliver is much more complicated than making a dinner reservation, but consumers don't understand those complexities. Find a partner who is equipped to provide white glove service to help you implement and onboard new technology, and remain a partner who you can easily reach throughout a lifelong partnership. Our client, Thomas I, provided the data and the graph on the right. They took this approach that done was better than perfect when they needed to find the right solution for online scheduling to help with their explosive growth. They implemented a self-service scheduling tool in October, and by January, growth was picking up significantly and doing it in the way they hoped, which was by appointments being scheduled by patients, then by staff, still growing overall. Scheduling isn't just a patient engagement tool, it's a patient revenue growth strategy to help your practice scale to new heights. And with that, I'll turn it back over to Matt.
Great. Thanks, Kristen, and thanks, Jonathan. I think a couple of takeaways here. One, to Jonathan's portion of the presentation, you've got to know your patient acquisition cost. That's the fundamental basis for which you can make future marketing investments. And then once you have that data, doing some of the things that Kristen talked about, like online patient self-service scheduling, will allow you to further increase those conversion rates, ultimately bringing down that patient acquisition cost. So Jonathan, Kristen, thank you both so much for what you shared today. Ultimately, we're running close on time. I think there are a couple of questions in chat. Jonathan and Kristen, we'll make sure to get you those, and we'll get answers to those folks as we leave here. And then we will also message the winner for our lunch giveaway here just following the session as well. So be on the lookout in your LinkedIn messages for a message from us. Next week, as we mentioned, we're going to be back here, same time, same place, this time talking about patient lifetime value. You're not going to want to miss this. It's a great follow-up to some of the building blocks that we covered today. So noon Eastern next Tuesday back here. We hope to see you. Jonathan, Kristen, thanks again. Really appreciate your insights. Thanks to our audience today for joining us. You can find the recording this week for both or on both the Clearwave and SocialClimb websites if you care to review or share it with others in your organizations. But with that, we'll thank you again and hope everyone has a great afternoon. We hope to see you next week. Bye-bye.
Bye.